Well, hello, everybody, and thank you all so much for joining us today. We are very excited to be having one of our Scripps Innovation Webinars and appreciate your participation. My name is Vanessa Scott, and I work in Industry Relations and Innovation here at Scripps Institution of Oceanography, and I will be your moderator today. Before I kick off the webinar, I just want to start with some quick housekeeping items. If you're new to this series, it will be recorded and available after the session through a link that you'll receive in your email and also on our Scripps Innovation Webinar website. Also, we encourage questions and discussion, and we'll hold them till the end after the presentation. So please feel free to enter your questions through the Q&A button on the bottom center of your screen or in the chat. And we appreciate everyone's questions that were submitted beforehand. And with that, I will kick it off and just say we are very excited to have our new webinar in the Human Health in the Oceans series of this series and hosted by the Scripps Corporate Alliance. A little bit of background about us. We are a division of UC San Diego, originally founded in 1903. We have about 2,000 students, researchers, volunteers, and staff in our community. We produce about 700 research publications a year and receive an average of $214 million in sponsored research annually. And our mission at Scripps is to understand and protect the planet and investigate the oceans, earth, and atmosphere to find solutions to our greatest environmental challenges. So here you can see kind of an outline of our main strategic research priorities, and our webinar series is focused on two of them, the first being risk and resilience to hazards, and the second, human health and the ocean. They occur quarterly, so please stay tuned for upcoming webinars. And the goal of this series is to inform our industry partners of our latest research and innovation, applied research tools, and ways to collaborate with our scientists and community to find mutually beneficial solutions. The Human and Environmental Health Initiative here at Scripps Oceanography brings together researchers from a range of disciplines, including oceanography, climate and earth science, cellular biology, natural products medicine, computation, environmental sciences, toxicology, and public policy. As you can see here, we've got 4 core themes that encompass pollution, marine biomedical models and cell biology, natural products, and climate impacts on human health. And with that, I am very pleased to introduce our speaker today, Dr. Tarik Benmarhnia, who is the Associate Professor of Climate, Atmospheric Science, and Physical Oceanography here at Scripps Oceanography. Tarik is an environmental epidemiologist that finished his PhD jointly from the University of Montreal and Paris Sud, and finished 2 master's degrees, one in environmental health sciences engineering from the French School of Higher Education and Public Health, and another in pharmacy and ecotoxicology from Montpellier University in France. He completed his BA in environmental sciences from Montpellier University. And to further his training, he was an environmental scientist on contaminated soil with the French Railway Company, followed by a health scientist position with the French National Institute of Health Education and Prevention, and most recently was a postdoc at the McGill University with the Institute for Health and Social Policy. Tarik's research interests include the impact of extreme weather events on human health in the context of climate change and advancing the notion of vulnerability and its implications for public policy. He also develops methodological approaches in order to evaluate the health impact of environmental policies, such as climate change adaptation measures and air pollution regulations. And with that, I will hand it over to you, Tarik.
Thank you so much, Vanessa. And thank you so much, everyone, for joining today, and good afternoon. And I'm very happy today to present about, I'm going to share my screen maybe. Yeah, so I'm very happy today to present some findings and some topics related to extreme heat, wildfires, smoke, and human health, focusing on San Diego. So most of the examples I'm going to talk about today will be very, very local to just illustrate the type of research we do here at UCSD, and also, the type of collaboration we have with community partners at the county and with different cities. And I will also illustrate a few ideas and activities we have in relation to specific technologies, including GPS and mobility data, to see to generate some discussion and potential collaboration. So yes, I will start by talking about the links between extreme heat and human health, and giving a lot of examples about San Diego. But my main goal will be to try to convince you that extreme heat is by far the biggest threat in relation to climate change impacts in the US, but also worldwide, but particularly in San Diego. But because of the indirect impact that are associated with extreme heat, and I'm going to talk about that later. And then I'm going to also talk about the different type of solutions that we can think about to try to mitigate this impact. And I'm going to talk about greening strategies, improving access to green spaces to reduce micro-heat island. And I'm going to talk about warning systems and how they work and how we can better inform the effectiveness of this heat warning system, for example. Then I'm going to talk about the context of climate change and why in the context of climate change, we see a change in a type of heat event we have, the flavor of extreme heat event we will have with more and more humid heat waves that will be driven by nighttime temperatures and why this is important. I'm going to talk about that and giving some examples about San Diego. And finally, the last section will be talking about wildfire smoke and human health in relation to climate change, and why do we see more and more wildfires, and what are the health impacts associated with that. And if I have time, I would like also to present you some results we recently got in relation to how wildfire smoke and COVID-19 kind of synergistically impact specific population, and how wildfire smoke may exacerbate some, like the severity of the symptoms associated with COVID-19. So first of all, when we talk about the impact of heat, it's important to focus on the direct impact. So when we talk about the direct impact, all of you are probably familiar with some of these symptoms, including heat cramps, heat exhaustion, or even most like severe outcomes, including heat stroke. So these direct impact associated with heat are relatively obvious and just like can be substantial and can have leading to premature death. When you suffer from a heat stroke after a few hours, if you're not treated, you can die from that. But it's important to consider and to understand that these direct impact associated with heat are only the tip of the iceberg. And just to give you an idea about why this is the case, when we look at the numbers about the number of deaths, for example, that are directly attributable to heat, the CDC estimates that on average, every year in the US, we have between 600 and 700 deaths directly attributable to heat. But then when we start calculating all of the other type of impact that could be indirectly associated with heat, the burden associated with heat is at least one higher order of magnitude, and up to 5 to 6 or even 700,000 deaths every year in the US. And that's another estimate. And the reason for which most of the burden associated with heat is indirect is because of this kind of exacerbation of existing condition. And here you can see, or like, summarized way, how extreme heat is going to impact our body and different organs through different type of mechanism, including, for example, inflammation. So here the idea is to say that, that when people, some specific individuals with pre-existing condition, including cardiovascular health, respiratory issues, including, by the way, complication from COVID, or diabetes, for example, this is where extreme heat will be particularly dangerous, because when you're exposed to high temperatures, through this different mechanism, it may exacerbate or trigger severe complication. And that will be the main reason for which, when there is a heat wave, a lot of people are going to be hospitalized or die prematurely. And this is why heat is a big, big public health issue, because of this indirect impact. And that's very important to understand when we want not only to understand the burden, but also to inform specific policies to try to mitigate this impact. So here, just to illustrate that, this is just some result from a study that was published few years ago, showing how many hospitalization were directly attributable to heat in relation to direct and indirect impact, state by state and for different causes of hospitalization. So, and this is, for example, just a result for California for all causes hospitalization. And this is the number of hospitalization each summer in California. And you can see that it varies between 6,000 and 8,000 hospitalization every summer in California. This is a substantial number, which means that if we're able to effectively prevent the burden associated with heat. Every summer in California, we'll see between 6,000 and 8,000 hospitalization less, which is a substantial number as compared to the direct impact, as I mentioned before. So this is just to illustrate how the direct and indirect impact are important, but most of the burden is driven by this indirect impact. And this is why we need to understand the underlying conditions that will make specific population and individuals vulnerable. So here, now we're going to go back and focus on San Diego. So what we know, what do we know, and what did we identify in the last few years working with the county and National Weather Services in relation to population vulnerability to extreme heat. So this is a study that was led by our colleague Kristen Gergis, where we wanted to assess, analyze the dose response, the relationship between extreme heat, lack of temperatures, and a risk of hospitalization, but across different climate zones. So here, as you know, in San Diego, we can have classify at least 3 types of climate zone. We can have the coastal region, we can have the inland region, and we can have the desert region. So here, this is important to show that, for example, when you see, for example, for this type of hospitalization, heat illnesses, we see that we have, the higher the temperature will be, the higher the risk of being hospitalized will be. But what is interesting here is to see that the threshold after which we start seeing an increase in the risk of being hospitalized, it's not the same at all between the coastal region and the desert region, for example. And you can see a difference up to 15, 20 degrees in Fahrenheit in the threshold after which we start seeing this effect, showing how there is a lot of different heterogeneity in how population will be specifically susceptible to extreme heat condition. And I will go back to that, which is very, very important, because heat is everything but a one-size-fits-all problem. We really need to understand what makes a specific community vulnerable to heat to inform the best we can what we can do. So here, this is again San Diego, and we can see, for example, zip code by zip code, how many people are hospitalized when there is a heat wave. And we can see, first of all, that this number is relatively substantial. For example, in zip codes in Chula Vista, for example, we basically quantify that when there is a heat wave day, on a given day, you have just for one zip code, 1 to 2 hospitalization. When you think about the size of these zip codes, this is relatively substantial, especially when you will have like during a summer, multiple heat wave events. But another thing that is interesting to see is like the huge spatial heterogeneity in this burden, showing that we're not all equal in relation to the burden associated with extreme heat. And what we're trying to do is to understand why we have that, and then what can we do to make basically all of the zip code look like this ones, with a very, very minimum burden associated with extreme heat. So when we want to understand what vulnerability means in the context of heat and health, this is first important to distinguish or to clarify what we mean by vulnerability. And in the work we do, we typically distinguish 3 dimensions. First, we talk about differential exposure, where, as we talked before, you will have different type of exposure to climate conditions in relation to the distribution of different type of temperature. When, for example, you see that extreme heat condition on the coast have nothing to do with what we see in Ramona or other like East County region. So that's the first component. This component is also important in relation to the concept of micro heat island in zip codes, for example, in which access to green spaces will be low, or in which you will have a lot of concrete impervious surfaces. So that's the first component. The second component is about what we call differential susceptibility, where we will have 2 communities or a group of individuals exposed to the same exact heat condition, but one group will be systematically more impacted because of different characteristics, including, for example, age composition, access to air conditioning, the type of housing, pre-existing chronic condition like diabetes, for example, etc., etc. So this is differential susceptibilities that also drive like this kind of heterogeneity in vulnerability, like in vulnerability to extreme heat. And finally, another dimension that is very important is to which extent when we implement policies, including warning systems or so, to which extent different populations, excluding the most vulnerable one, are going to receive proportionate benefits and to which extent the benefits will be equally distributed across different population. And that could be important. For example, let's say we implement a system for vouchers for access to air conditioning. We really need to make sure that if these vouchers are in place, that most vulnerable population or most susceptible population in this context will have access to it and will know about it and will have access to it in order to get all of the benefits from this type of initiatives, for example. Just some examples about some obvious examples I will start with about what constitutes like this differential susceptibility that explain why we see this variability in like the vulnerability to extreme heat condition in San Diego. So here, this is just to show that, as anyone can expect, that age is a strong driver of heat vulnerability, whereas the risk associated with extreme heat is way higher among population aged more than 65. And here, another obvious susceptibility factor is related to access to air conditioning, where we can see that basically in neighborhoods in which access to air conditioning is high, there is like, it basically attenuate or even eliminate risk associated with health risk associated with extreme heat. But here, this is also important to show this important environmental justice implication in terms of access to air conditioning, where you see a very, very strong correlation between access to air conditioning and income level in each neighborhood. And that's a very important connection. And we'll go back to that. Then, just to illustrate the type of work we're doing in this area, I wanted to show you these studies that we recently did that will be published in the next few weeks / months. We wanted to understand the specific vulnerability among persons experiencing homelessness in San Diego. And we wanted to assess a few different things. First, to which extent people like homeless individuals are particularly susceptible to extreme heat as compared to counterparts based on age, gender, race, ethnicity. Then we also wanted to compare different types of extreme heat conditions, because as I said before, it's not a one size fits all. There are many, many types of heat conditions, and we really need to understand like the differential impact from these heat conditions. So for example, we consider different types of heat wave definitions based on maximum temperature, daytime temperatures, or nighttime temperatures. Or we considered like, for example, heat waves that will be only on one single day, or heat waves that will last 2, 3, or 4 consecutive days, for example. So here we can see to which extent homeless individuals are systematically more vulnerable as compared to their counterparts in relation to most of the extreme heat events, except few of them. And here, what we wanted to do as well is to understand like the specific characteristics of persons experiencing homelessness in San Diego that make them particularly vulnerable. So we started by focusing on age. And here we can see that, yeah, of course, like homeless individuals more than 65 are particularly vulnerable, but surprisingly, we also found that the younger age groups are extremely vulnerable to extreme heat, in particular to daytime extreme heat, which is relatively useful information in order to identify and shape targeted intervention for this specific population. Here, we also found that most of the burden is driven by homeless individuals with pre-existing mental health issues. And something that is well documented in the literature about how like mental health is a very, very strong pre-existing condition to be exposed and to be impacted by extreme heat. And this is actually what we found in a community of persons experiencing homelessness in San Diego. And finally, we also wanted to explore to which extent there was some ethnic differences in the vulnerability to heat. And we found that, especially for Hispanic individuals living, like experiencing homelessness, there was a very, very strong vulnerability, especially for nighttime heat condition, heat events. So this is just to illustrate and to show you some examples about the type of work we do to try to identify why do we see such heterogeneity in the burden associated with heat, mostly coming from indirect impact, and what type of assessment we can do to identify which population are vulnerable for which condition and what can we do with that. So now I will talk about what we can do, about the solutions, to be a little bit more optimistic about what we can do. So I will talk about two types of intervention that are the most common actions and policies that are in place to try to address health issues associated with extreme heat. So first, I would like to talk about greening strategies, which is basically increasing the number of trees in order to reduce like microheat islands through evapotranspiration and just reducing local temperatures. So here in this study that we conducted a few years ago, we just wanted to quantify the systematic vulnerability associated with living in a neighborhood with a lot of microheat island. And we found across any epidemiological studies that were published by them that living in a neighborhood with higher or lower access to green space or higher density of impervious surfaces, for example, was associated with a systematic increase in the risk of mortality or hospitalization. So this is another study that we conducted specifically in San Diego. And here we wanted to, we conducted a lot of simulation in order to document, to propose like solutions to optimize the implementation of greening strategies. So his idea is that we started from this pattern about, okay, what is the baseline vulnerability to extreme heat? And we also considered the baseline exposure and characteristics in terms of access to green spaces using different type of indexes, such as like remote sensing products based on, for example, NDVI or tree canopy, tree cover, or the density in terms of impervious surfaces. And then we simulated many scenarios in which we would improve access to green spaces using information from like neighborhoods in which there is a lot of green space already. And we compared many scenarios to see what would be the way to implement green spaces in order to optimize or minimize the burden associated with extreme heat. And here we were able to identify with one specific scenario, for example, which neighborhood will benefit the most from having an intervention that will improve access to green spaces in order to reduce the heat burden. And we compare different types of approaches based on, for example, the population-based approach in which we're going to increase access everywhere for the entire distribution, or in which we're going to target, like, for example, zip codes with the highest burden associated with heat, or zip codes with the lowest access to green spaces, etc., or approaches based on what we call proportionate universalism, in which we're going to provide access to green space everywhere, but proportionately to the existing and baseline vulnerability. And we propose that, and we work with the county about that to try to identify what will be the optimal scenarios for greening strategies, again, to reduce the burden associated with extreme heat. Another type of intervention that we can think of in order to reduce the burden associated with extreme heat is based on early warning system, heat warning system. So just to give you an intuition about how this warning system works. Basically, for example, in the US, you have the National Weather Services that, based on specific conditions that they a priori identify, are going to trigger heat alerts. But these heat alerts basically include communication actions about what to do not do, and we'll share these information to different channels. But this is not just about that. In many jurisdictions, in cities, in counties, they also implemented what we call heat action plan. And this heat action plan include a lot of community-based actions. For example, opening cooling centers, or distribution of water, refreshment, or specific like health professional visiting specific household or specific location, just to make sure that some identified vulnerable population are doing okay. So how it works is that when National Weather Services are going to trigger these heat alerts, like jurisdictions that have an existing heat action plan are going to activate these community-based actions and going to start sharing these resources, opening cooling centers, etc. So this is how it works. But here I wanted to show you an example about, this example about New York City, the work we did years ago with the City of New York, that I think tells a lot about why having a local epidemiological evidence is super important to inform this type of warning system and the threshold that could be used to trigger them. So just here on the left, this study evaluated before 2006 the effectiveness of the National Weather Services heat alert systems. And in different cities in the northeast of the US, including New York City. And here, basically, at this time, National Weather Services were only using one threshold for this entire region to trigger heat alerts. It was 105 Fahrenheit. But then after 2006, the city of New York decided to conduct local studies, like epidemiological studies, to try to identify the local vulnerability to extreme heat, like what I showed you for the context of San Diego. And actually, epidemiologists at the city, at a like a health department in a city, identifies that most of the burden, most of the hospitalization and premature deaths took place way before 105 Fahrenheit because of like the very specific geography of New York City with a lot of microheat islands, and actually identifies that 97 or 98 Fahrenheit would be a more appropriate threshold to activate all of these actions. So in 2008, what they did is simply to reduce the threshold, keep the same type of community-based action and communication actions, but just reduce the threshold at which they trigger all of this action. And what we found, we worked with them to evaluate the effectiveness of this, just like this simple modification that was based on local evidence. And what we found is that only 2 years after the implementation of these changes, we saw like that half of all of the burden in terms of hospitalization attributable to extreme heat was prevented, which is substantial, only in 2 years, just with this simple modification to see that this type of action work as soon as they are based on some kind of local evidence that considers this local vulnerability to extreme heat. So this is what I wanted to say about warning system, and also wanted to highlight some new insights and new research areas that we're working on that would be interesting in terms of technology. So for example, in this recent paper, we assessed to which extent we can use mobility data to evaluate the effectiveness of warning systems when there is extreme weather, for example. So we focus on different types of examples, including hurricanes, extreme heat, and wildfire. And here we really wanted to see to which extent we could use this mobility data. This data has been has become popular in the context of COVID because a lot of studies use this data to evaluate to which extent stay-at-home orders were effective or not to reduce population mobility. So here the idea is to see, can we use this type of data to evaluate to which extent this warning system work? And here you can see, for example, for hurricanes, that when a hurricane is taking place, you have a significant decrease in mobility. Mobility being defined by phone activity, and we can detect to which extent the individual is going to stay at home or leave their home based on this information. And here we can see the same in relation to extreme heat days in different states, and here same thing in relation to smoke warning system in the context of all of the events that we observed in the fall of 2020. Another kind of study that I wanted to share with you is also based on monitoring indoor temperature, because as you know, we spend most of our time indoor. And most of the studies that I showed you before are really based on outdoor condition and outdoor temperatures, but we really don't know what's happening inside houses, especially in people that don't have access to air conditioning. And also another problem is that most of the data and information I shared are based on very severe health outcomes. We talked about premature mortality, we talked about visiting the emergency department or hospitalization. This is quite severe. So here's the idea of this study that we conducted in Longueuil, Quebec, which is a city near to Montreal. We wanted to, first of all, monitor indoor temperature and humidity within the house using this type of sensors called hobos. And we implemented these sensors in 277 households to capture continuously temperature and humidity. And then we also wanted to collect a lot of different symptoms based on, for example, like mental health or like a sleeping issue or like dark urine, etc., fatigue, etc., just to try to identify what will be the first symptoms that we see taking place when temperature increases. And here you can see, for example, an increase in a risk of reporting like sleeping issues as a function of indoor temperature. And here we can identify a specific threshold after which we start seeing this symptom taking place. And that could be extremely useful to, for example, design a just-in-time intervention, for example, based on all of this information that now become more and more accessible and easy to collect. So that's, just wanted to give you some examples about the type of work we do in which we use this type of sensors. Another example that I wanted to share with you is based on data collected from GPS and accelerometer data to consider some like the kind of the dynamic perspective of the activity space we're exposed to typically on a given day. Because as you know, we spend, on a given day, we go to different places and we can't just assume that we're exposed to the temperature that we have in our neighborhood where we live. And here, for example, we use GPS and accelerometer data from another study that we conducted. And here, this is just one individual. So we can see this is San Diego. So we can see, for example, across multiple days, like this is where a given individual is going. And using accelerometer data, we can also detect specific patterns in terms of the type of activity this individual was doing. So for example, we can determine that at this specific places, the behavior was stationary, or this individual was driving or in a car in this specific location, or was walking in this specific location. So yeah, don't hesitate if you have a specific question about how we can use this type of accelerometer data and different type of algorithm to try to identify the patterns that allow us to say that this pattern is a walking pattern, for example, or biking, etc. So using this information across multiple individuals, we're also able to combine that with like a data set of microclimates in San Diego County, just to see to what type of climate environments like different individuals are exposed to, considering the activity space. And that type of work is also important to show how we can combine different type of GPS and accelerometer data to better understand what we can do and in which places we can dynamically intervene to reduce exposure to high level of temperature to harmful microclimates. So yeah, so now I will just checking the time here. I wanted to talk about climate change. So all of the things that we talked about are a problem by itself, but it's going to become an even bigger problem in the context of climate change, because what climate change is going to do in this context is just to exacerbate existing weather conditions by making more and more severe heat conditions. Going to have like a change in the seasonality of this extreme heat event, and we have more extremes and more severe extremes, and so on and so on. On top of that, and that's very important for San Diego particularly, is that climate change may also change, like create unprecedented situation or create a new problem. And in this context, one problem that I'm going to talk about is a change in the flavor of heat waves, where we'll see more and more humid heat waves and heat waves that will be driven by nighttime temperature. And that's very, very important. This problem has been raised a few weeks ago in this article in the New York Times explaining what we see so far and why this is a problem. And I wanted to share some slides and results by my colleague, Sasha Gershonov, whom I say as well, about just like what to expect and what we already saw in the last few years and what to expect for the next few decades in the context of climate change. And here you can see that before, like up to today, we see that most of the last extreme were driven by nighttime temperature. And when we use climate simulation to try to see what we may expect in the next few decades, you can see that most of the biggest extreme heat situations that we may expect in the next few decades will be driven by nighttime heat wave, driven by humidity. And that's a problem because, as I mentioned before, all of the actions and all of the existing community-based action that I mentioned before in the context of warning system, for example, are based on daytime activities. But in few years and few decades, this type of action may become totally obsolete because most of the burden will be taking place during the night. So we really need to think and consider how we can use this information to develop new type of actions, to consider the impact that climate change will have on the type and flavor of heat wave we're going to be facing in the next few decades. And here, I wanted to show you some very recent results that we estimated, again, in collaboration with the county of San Diego. And his idea was just to try to classify zip code by zip code what type of heat condition were associated with the highest burden. And first of all, you can see that you have, again, a lot of variability, showing that we can't think of heat as one single problem. We really need to think that about that locally. And here we classify the type of heat condition according to at least 3 characteristics. The red one, the red zip codes will be the zip codes in which most of the burden is driven by maximum temperature daytime heat events. The violet one will be zip codes in which the burden will be mostly driven by nighttime temperatures, already using data from the last few years. And the green one will be based on what we call diurnal temperature, which will be the difference between nighttime temperature and daytime temperature, minimum and maximum temperature. That will be another type of heat condition that we need to consider. But here, this is just to show that we already see this kind of pattern in which we have more and more zip codes that will be driven by diurnal or minimum or nighttime heat conditions. And right now, most of the actions that are in place implemented don't consider this specific type of vulnerability, but instead focus on daytime activities. And in the context of climate change, this pattern is just going to become more and more exacerbated. So that's what I wanted to share with you about heat and health, to explain why heat is a big public health issue, emergency, and why we really need to understand what's happening locally in terms of vulnerability to extreme heat and what type of actions we can think about. So now I will switch to another big threat and big issue we have here in San Diego and in California more generally, wildfire and smoke in relation to public health. So very quickly, I wanted to just give some context very quickly. And of course, if you have any question, I would be more than happy to answer the details. So here you can see that among the top, the largest wildfires that were ever recorded in California, you can see that the largest one took place in the last decade or even in the last few years when you look at the 3 biggest fires that took place in the last 2 years, basically. And that is not a coincidence at all. In parallel, we also see in the last few years, like a change in the seasonality of these large wildfires, because here we can see that more and more of these wildfires are taking place in the fall, typically right now, in between October, December. And why do we see that? There are 2 components that explain this specific pattern. The first one is change in precipitation regime in California that is basically driven by climate change as well. And where basically, just to give a very simple explanation, we have the same amount of rain or rainfall on a given year, but that would be concentrated in fewer events. That would be on top of that concentrated with a strong seasonality, driven by specific type of events like atmospheric rivers, like for example, what is expected to see in the next few days in Northern California. So that what happens is that instead of having multiple days of rainfall, we have less days that will be typically taking place in the winter, and will bring a lot of water in only a few days, followed by a long period of drought up to the summer. So there will be a lot of vegetation that will dry up to the summer when it becomes very, very hot. Then what happens is that at the end of the summer, typically, and that's the case in Southern California, this is when specific downslope and strong downslope winds, such as Santa Ana winds, are going to start blowing. In Northern California, they have a very similar type of patterns based from the Diablo winds. So here, the idea is that we have these 2 components. We have a lot of precipitation taking place in the winter following this change in the precipitation regime. So that will bring a lot of vegetation that will dry up to the summer. And then when the vegetation is totally dry and ready to burn, this is when very, very strong and hot winds are going to start blowing. And that will be a perfect combination to start fires, but also have fires that will spread very, very quickly. And on top of that, all of the smoke will be transported to the coast where most of the population, at least in California, is living. So this is why we see this type of pattern, not only the change in intensity and severity of fires, but also this very, very important change in the seasonality of this type of fires. So now let's talk about the health impact. So when we consider the health impact associated with wildfire, this is very, very important, again, to focus on a direct and indirect impact. And of course, communities that will be directly exposed to wildfire will be particularly at risk because you can be through intoxication to carbon monoxide, for example, or other type of issue from being evacuated also. But very few individuals will be directly impacted by the wildfire. The biggest problem in terms of criticals will be the smoke that will be generated by this fire and can be transported across many miles or miles away from where the fire is taking place. And that is like you're going to be helped by the Santa Ana wind patterns. And the smoke is mostly constituted by what we call fine particles, PM2.5. And that now explain why we have this huge burden on population health through the smoke, and why actually nowadays air pollution in California became a wildfire smoke problem as opposed to a problem related to traffic emissions or industrial emissions. And that, for example, like what is studied by Ford and colleagues shows that what we expect is to see that most of the air pollution concentration in the next few decades to be just basically driven by wildfire smoke. So wildfire smoke is mostly constituted by fine particles, PM2.5, that actually are defined based on our body. As are defined with this specific size, because this is a size that is needed for a particle to interact with the circulation system. This is a size that is needed to go into the alveolar, where you have the exchange between oxygen and the bloodstream. And because of that, like PM2.5 will be able to interact with many organs in a body. And just very briefly, but the three main physiological mechanisms that explain why PM2.5 are dangerous for human health include inflammation, oxidative stress, but also an alteration of the immune system. And that is particularly important in a context of infectious diseases such as the COVID-19, because it explains why when you're exposed to high level of PM2.5, your immune response will be altered, will be reduced, and may expose you to more severe outcomes in relation to an infection, such as an infection from COVID-19. Another type of question that is of interest is to which extent PM2.5, when coming from wildfire smoke, is more toxic, more dangerous, as compared to PM2.5 coming from other sources of emissions, including traffic or agricultural activities. And we conducted a study to try to answer this specific question last year. This study was led by a colleague, Rosana Aguilera, in which we wanted to compare the specific toxicity of PM2.5 from wildfire as compared to PM2.5 from other sources of emission that are not wildfire. And we found, unfortunately, that most, using different type of approaches, that the toxicity of wildfire for the exact same dose is up to 3 to 10 times more dangerous for human health, which means that when you're exposed to the same dose of air pollution, if it's coming from wildfire smoke, it will be 3 to 10 times more dangerous as compared to other sources of air pollution, which is not good news for us, because now most of the pollution problems and most of the PM2.5 we're going to experiment in the next few years and decades will be coming from wildfire smoke. This is just another study in which, focusing again in San Diego, just to show you some local data about how, again, the smoke has a very strong spatial pattern, because here this is just to show the very strong correlation between where on the left the smoking is going and where the hospitalization that are attributable to this PM2.5 is happening. And you can see really that there is the burden, hospitalization definitively follow where the smoke is going. So I just wanted to share this information because we conducted this study in San Diego. And finally, and I will stop in 2 minutes, I wanted to share a few insights about the links between these compounded impacts between extreme weather events and COVID-19. And of course, as I said before, there are many reasons to think that mechanisms through which, for example, exposure to PM2.5 impacts the immune system may make some individuals more susceptible to severe outcomes in relation to an infection to COVID-19. And on top of that, you also have a lot of opportunities to evaluate the potential benefits associated with the lockdown policy taking place, that took place in the last 2 years, as a natural experiment to see to which what could be the benefits of very drastic policies to reduce emission from traffic, for example. And all of this situation were a good setting to understand this mechanism and these patterns. So I'm just going to share with you one study that we recently conducted, in which we wanted to see to which extent in an event like wildfire event that took place in a Bay Area in August, September 2020, we wanted to see to which extent the severity of outcomes associated with an infection to COVID-19 were exacerbated or not. And we considered what we call the case fatality rate, which is basically the proportion of people that will be infected that will die from this disease, from COVID-19. And here we can see, as compared to a counterfactual scenario, that will be like the incidence or the rate of case fatality rate in the absence of the fire. And here we can see in Alameda County and San Francisco County to which extent when the fire started and when there was a lot of smoke, we saw an increase in this case fatality ratio, which means that the proportion of people being infected by COVID that died from it increased during the fire or after the fire, because there is this phenomenon that we call lag effect that was also important to consider. So this study is just to illustrate how, again, all of these hazards are not exclusive from each other and may play together to exacerbate vulnerabilities. And again, when you look at which communities are going to be mostly impacted by air pollution, wildfire smoke, COVID-19, extreme heat, etc., it's systematically the same communities, and this is not a coincidence. It's based on structural determinants of how population is going to be exposed to like these compounding impacts. And this is why we need to systematically think about like this environmental justice implication of this climate change and health connections. So I will stop there. So we have time for questions. So I hope that was interesting, and I was giving you an overview with a lot of details and examples about San Diego. But I think San Diego is very interesting to study for this question because there is a lot of variability, a lot of in climate, population, etc. So thank you very much. And this is my email. If you have any follow-up question, please do not hesitate to reach out. I will be more than happy to answer your questions. So thank you very much. And
thank you, Tarik. Thank you so much for that great presentation. I think we will have a lot of great questions, and I encourage everyone to put them in the Q&A or the chat. And as we're waiting for people to put questions in there, I saw that you shared your email address. Just wanted to have a follow-on question to how companies or industry stakeholders can collaborate with you and your lab to take this very valuable information and apply it to their industries to make better decisions. Oh, I'm sorry. Oh, yeah, I could repeat the question. Just asking how companies can collaborate with you.
Yeah, I can go ahead. But yeah, I guess that's why I included this specific recent work we did in terms of like phone and mobility data. And I'm not sure who is in the audience, but there's a lot of work to do in terms of how we can understand where people go and what type of, what we call that just-in-time intervention, which is like, for example, specific messages that will indicate, like make recommendation about types of behaviors to have, for example, to reduce like activities that may exacerbate heat, like heat exhaustion or something like that, for example, or just to understand where it would be a good idea to go during a heat event or during a wildfire smoke, to identify the cooling zones, to identify like areas with some air filtration and things like that. And I think everything has to be done in this area.
Agreed. Excellent. We did have some questions that were submitted beforehand. Oh, here's a question in the chat from Lori Mendez. Hello, Dr. Benmarhnia. Are you sharing your work with the City of San Diego to make recommendations to help with their draft resilient adaptation plan?
Absolutely, yes. Actually, we work a lot with the county and with the cities. And right now, like a few months ago, we started what we call a white paper about heat and health. And basically, this is just a big document in which we're going to summarize everything we know and we don't know in San Diego in relation to heat and health. So we are finalizing this document like these days. And the next step actually is to conduct an extensive survey. So we just hired someone to conduct these surveys across all of the cities in the county to identify what type of actions cities are doing and implementing to address heat and to identify the barriers and facilitators for this type of actions. So we are right now doing this type of investigation with the county and many cities around.
Excellent. Thank you, Tarik. All right, we've got a couple more great questions here from Morgan Justice Black. Is this data related to zip codes that would benefit most from urban greening strategies publicly available? I think you mentioned you shared it with the county. How can someone access that zip code data?
So it depends the thing that we can't share because of privacy concern is the hospitalization data, because there was a lot of information that none of us wants to have shared, but we can share like numbers of the total number of like the burden. I think it's not sensitive at all, and I would be more than happy to share this data. We can also share all of the green space data that we have. We have a lot of like information about tree cover, tree canopy, and DVI, impervious surfaces, and these combined indexes that were created too. That I'm more than happy to share if can be useful for other contexts.
Excellent. Thank you, Tarik. All right, next question from Gary Reichard. Did you observe increase in VOC and CO2 indoors with air conditioning and hospitalizations? I observed a significant increase in apartment communities with air conditioning.
Yeah, so that's this is very likely to happen, but we didn't collect this information in, for example, the study about indoor temperature. And that's something that it makes a lot of sense nowadays to capture to which extent like indoor air pollution is what's happening when like between like when, for example, there was a wildfire smoke impact in San Diego. What would be the strategies to reduce indoor exposure, including HEPA or air filters that we are relatively straightforward to use, and actually a very, very good solution to deal with the COVID, because which is mostly transmitted by like through aerosols. And having this kind of air filters at home is definitely a good idea for a million of reasons, including reducing exposure to carbon monoxide, but also PM 2.5 when the wildfire is hitting San Diego.
Great. All right, we've got another question from Anna Corcoran. Tarik, do you know of or foresee any regulations or policies in San Diego or California to address the increase in health impacts due to wildfires and extreme heat? Could this possibly lead to impacts on industry needing to lower their emissions or impacts during high heat or wildfire periods?
Yeah, so two different things. It's a complex question because it's interrelated. But one thing about when you have a smoke warning system, right now, it's mostly based on behavior changes at the individual level, where we ask people to do not go outdoors, do not practice any physical activity, to have some air filtration, etc. However, when you think about PM 2.5, etc., and there are other jurisdictions, other cities in which actually they also try to reduce, collect at the community level emission from other sources of pollution. And the idea is that there is like a lot of smoke coming that we can't control, but at least we can try to reduce other sources of contamination to at least reduce the total concentration of PM 2.5 communities will be exposed to. So that's one approach. Then there is like more complex setting in relation to heat and smoke, and also what we call like tropospheric ozone, which is a secondary pollutant that is extremely dangerous for human health, that will be generated on days with high temperatures and a lot of sunlight. And that is also, during these days, it's very important to not only act on heat, but to try to reduce the precursors of ozone, including NOx and O2 that are emitted from traffic. And that's why just to kind of connection between sources of emission and this type of warning system is very, very important too. So but that's a very complex topic.
Great. We have another question that came in about the green spaces. How long, in your opinion, would it take to grow the green spaces needed to reduce hospitalizations, like to scale future county investment? Would it be 2 years or less for a big impact, or longer for a larger canopy?
2 years is a stretch, but it depends what type of greening strategy you implement, because I talked about green spaces as an example, but you have a lot of other strategies to reduce microheat islands. For example, just like, the color of roofs makes a huge difference in terms of, so the albedo makes a lot of difference to the kind of contrast in temperature and indoor temperatures. So this type of interventions that actually are taking place in a lot of low and middle income countries, just basically to paint the roof in white makes a substantial difference. And a lot of strategies like that to also reduce, change the composition of roads reduce this kind of like to reduce the kind of the local temperatures. All of these things can have like an impact right away. And for greening, it really depends on the type of trees and the existing vegetation in place that you want to enhance, etc. So, but I would say 2 years is probably a stretch, but that it's probably something across multiple years, multiple decades. But the sooner we start, the better it would be.
Great. So many good questions. Thank you, Tarik. We've got another one from Bob Leiter. He's asking.
I know him.
Oh, great. Bob's asking, do you think that one of the possible responses to your findings would be to encourage homeowners to equip their homes with air conditioners and air purifiers that could be activated during a wildfire recovery period?
I think it's part of the solution, yes. I don't, because the problem with air conditioning, for example, I think air purifiers, yes, for everyone is relatively cheap, and we should encourage vouchers to have everyone have access to that. There is a lot of benefits associated with air filters at home. For air conditioning, the thing is that it's like a, what do you say that in English, like a sword with two like a two-sided sword, because of course it's extremely efficient, but at the same time it does two negative things. It increases local temperatures, because this is how air conditioning works, so that will exacerbate the micro heat island effect. And for example, there are 2 studies in LA and Phoenix that show that on average, use of air conditioning increasing local temperatures by at least 2 degrees. This is huge. So that's the kind of problem. The other one is also emits a lot of greenhouse emissions, like greenhouse gas emissions. And that's kind of just like not like a sustainable solution. However, given the huge burden some specific individuals have, I believe that targeting few individuals and providing access to air conditioning for specific individuals where nothing else can be done, really, because if some people living in buildings, etc., access to green space won't change anything. And I think identifying some communities or individuals in which air conditioning will make a huge difference would be a good idea too. But it's not something that I would universally recommend for the reasons I mentioned. Thank you, Bob.
Excellent. Well, thank you so much, Tarik. I think that's all the questions that we have. Thank you for that amazing presentation and great information, especially in the context of the wildfire season that we all just experienced. I would just like to end by sharing a quick slide to just let people know that we have our next webinar coming up on November 9th, same time, 12 to 1 p.m. And it's going to be talking about UC San Diego's role in blue tech innovation. So please visit our website to find the link to register, and please join. And again, if you have any interest or questions, would like to have an exploratory conversation on collaborating with our scientists like Tarik, and would like to continue the conversation, please feel free to reach out to Gwen Nero, the Director of Corporate Relations and Innovation, or myself, and our email addresses are up here. So with that, I would like to thank you all again for your attendance and participation and your wonderful questions and the great conversation that was had. And we look forward to seeing you again soon.